Mistake number one, and it's a big one, stretching your plantar fascia in the first phase of recovery. Stretching is very commonly recommended for plantar fasciitis recovery, but performing these fascial stretches, especially in this initial phase of your condition, can actually have several negative effects. Some of the key drawbacks are when the plantar fascia is damaged, weak and sensitive, overstretching can actually cause new tears in the already damaged plantar fascia, leading to even more pain, new inflammation, and prolonging your healing process. There's also the risk of further injury, as stretching can put additional strain on other structures of the foot, such as your Achilles, your calf muscles, potentially leading to secondary injuries. And the plantar fascia, like any tissue, needs a relatively consistent, stable, non-irritating environment to heal properly. So premature stretching can disrupt this environment, leading to incomplete or improper and even disorganized healing or scar tissue. There's also the chance of what known as reactive tightening, where pain and overstretching can result in the tissues in the foot and the calf area unfortunately tightening in response to this type of reflex. This will worsen your foot stiffness and lower leg discomfort, and this is similar to the protective guarding scenario commonly found with injuries, where the body may naturally guard against pain by tightening the muscles, making effective stretching difficult and potentially counterproductive. Patients experiencing increased pain from damage through stretching may also actually become less compliant with their treatment plan due to the negative connotations established with this, and it's totally understandable. Now, this leads me to the psychological impact this has on some patients, with the anticipation of pain during these stretching routines that creates anxiety and fear, and negatively affecting the patient's mental state and willingness to engage in any potentially beneficial rehabilitation exercises in the future. Now, a major concern, and what's particularly relevant given the amount of stretching advice found online these days, is the fact that stretching your damaged plantar fascia can perpetuate the inflammatory cycle and preventing the acute phase from transitioning to the very beneficial healing phase. We know that any prolonged inflammation and irritation contributes to the condition becoming chronic and degenerative, which is making it much more difficult to treat in the long term. So by avoiding stretching your plantar fascia during this acute phase, patients can promote a more effective and less painful recovery from plantar fasciitis.